Hello, I'm John Oppenheimer, and I'm clinical professor of medicine at Rutgers University, and I was on the task force for the American Academy of Asthma, Allergy, and Immunology on choosing wisely. And my choosing wisely suggestion was don't diagnose or manage asthma without spirometry. Clinicians often rely solely upon symptoms when diagnosing and managing asthma, but these symptoms may be misleading and be from alternative causes. Therefore, spirometry is essential to confirm the diagnosis in those patients who can perform the procedure. Recent guidelines highlight spirometry's value in stratifying disease severity and monitoring control. History and physical exam may over or underestimate asthma control. Beyond the increased costs of care, repercussions of misdiagnosing asthma include delaying a correct diagnosis of treatment. So I would start by asking, what's spirometry? We know that asthma, which is a symptom or constellation of symptoms including shortness of breath, wheeze, cough, inability to do activities because of respiratory compromise, can be due to many things. Things like having a chronic cough after having a cold, or somebody having sinus disease or heartburn may all manifest with these symptoms. So having an objective measure, a tool, think of it as a blood pressure monitor of your lungs, allows you to better define, is there really lung disease or an impediment of breathing out or not? Unfortunately, history and physical exam can over or underestimate or over or underdiagnose asthma, and the result could be either misappropriate use of medicine not needed or undertreating the illness. For this reason, it's no surprise that recent guidelines have highlighted that both when looking at severity of disease as well as level of control, symptoms as well as an objective measure of lung function like spirometry are needed. I find it really helpful in treating my patients. And a good example is a study by a fellow named Dr. Magdal that showed that a subgroup of asthmatics are really bad at identifying their level of disease control. And without an objective measure like spirometry, they actually think they're in much better the control than they are. And it turns out this group of patients have a much greater likelihood of dying from asthma. So another reason to have this tool is to ensure that we're not missing those people that have this poor perception of their level of shortness of breath or disease control. So for all of these reasons, I would encourage people not to diagnose or manage asthma without spirometry.